Hi, I'm Natalie Jill, fat loss expert turned lifestyle and high performance coach. Welcome to Listen Up, the podcast. On this podcast, I do what I do best, taking complicated information that is relevant to us now and breaking it down simply with actionable steps you can implement to level up your life. I also regularly interview some of the most inspiring and courageous men and women on the planet who, at their worst, learned how to achieve success greater than anything they ever dreamed possible, creating everything from nothing. If you are new here, I encourage you to go back and listen from episode 1, when this podcast was previously called Leveling Up, for the full transformative experience. I'm so excited today because I'm here with my friend, Dr. Emi, and she is a board-certified internal medicine doctor with a specialized training in holistic and functional medicine. And she is a genius when it comes to Nutrigenomics. I had never even heard of that before I met her. I didn't know I'm pronouncing it right. And then gut health, which we've all heard so much about these days, gut health, like what that has to do with weight loss, with our health, with our pain, with everything. So I'm so excited to dive in and talk with you today. Thank you so much for being here.
My pleasure. I'm really happy to be here and talking about my favorite topics. So thank you for having me, Natalie.
So take us back a little bit, because you've been a doctor for quite some time, but there was an unauthentic disconnect at one point where you were 100 pounds overweight and you were talking with patients about health and fitness. Tell us what that was like and what was the turning point and the change for you to start getting healthy and figuring out what you know now.
Well, it was a long journey because, of course, medical training does not lend itself to good health habits, specifically, our regular, what we call allopathic medical training, which is what I went through to get it to be an MD. I mean, there's these long nights, there's pizza at the hospital, et cetera. So that was never healthy, but I did get really on a health kick because, I was so overweight. I'd had these 2 kids. Those who know me know that one of my kids was on the autism spectrum. So I was trying to be healthier for him. But, I was eating kind of what everybody thinks is a great diet, 1,200 calories, brown rice and vegetables, going up the local mountain. But I still was 235 pounds, really like 100 pounds overweight. And I remember a patient that I was talking to about her diabetes saying, well, you're razzing me so much about your diet, my diet, but you're 100 pounds overweight. And it wasn't really for lack of trying. It was really for lack of great information out there to help me get to the right weight. And that's where I see a lot of patients. I mean, they're just kind of told by docs like, hey, eat less and exercise. And that's supposed to be the magic way they're going to get thin. But that's exactly what I was doing when I weighed 235. So, I know that that's not the answer.
Well, okay. First of all, how did that feel as a doctor? Like, you're hearing that from your patient, she's right, but you're obviously, I'm assuming, feeling really uncomfortable. Like, what did that do to you? What made you change? Is that what made you change?
I mean, I was really very uncomfortable in my own skin, as you might imagine. It was very hard to, shop for anything. I think I told you this story before because we're friends, and I had an older friend who was a therapist in her 80s, and she just told me how worried she was for me, and she didn't feel like I was going to live long enough to raise my 2 kids who were like 2 and 5 at the time, in my early 30s. And so, it was a really sad time for me. And that's kind of why I really feel for a lot of women out there, because they feel like it's their blame, or people are looking at them like they're not doing all the right things. But of course, they're trying their very best, like I was, but they're just not given a lot of the specific information that can really help them.
It must have felt, first of all, I give credit to that patient and your friend, because we tiptoe around that topic with people. And hey, I'm in the fat loss industry and I tiptoe around it. Like, it's uncomfortable to tell people what you're observing or what you're seeing. We think It's like not correct to do that. However, because of those interruptions, you actually said, okay, this is not just for me. Like, people are noticing this. This is affecting other people. And so it's interesting that they spoke up, which must felt very uncomfortable when they did it, but it actually was a turning point for you.
It absolutely was. Yeah. It's one of those things that jolts you into, it's kind of like that old saying where the symbol in Chinese for, it's like crisis and victory are kind of together in the when you have a crisis, it's basically like danger and victory, are in the same symbol. And it's kind of the same thing, you're sort of staring down where it could be and the better path that you could take. And for me, that path was really learning functional medicine, that's deeper dive at looking at patients and getting to the root cause of things the way medicine used to be, and really approaching weight loss from that approach rather than the kind of band-aid way that medicine approaches everything today in our regular medical system.
Because as an internal medicine doctor, I'm assuming what you were really trained on was like prescriptions and this symptom, we need this versus like the whole picture.
Yeah, very heavy hospital training. Actually, I spent a lot of my career in the ICU. And in fact, even when I had a private practice in town, I mean, I was recruited to this town as a young doc because I had a lot of ICU experience and they needed that in a small town. And so that was part of my problem too, is I was on call like 24/7 if somebody landed in the hospital and they were crashing, and we're in this small town where a lot of the roads get closed at winter, and I would have to go in rain, shine, birthday, not birthday, whatever. So yeah.
I have a lot of questions for you, but I do want to ask you first this for listeners. What's the difference between like what you do as an internal medicine doctor with a specialty in holistic medicine versus like a naturopathic MD or a functional medicine doctor? What is the difference with all those things?
So I am functional medicine trained, which is just functional medicine is just a way of looking at patients, which takes their whole being into account. So it's not just looking at you from like the moment you come in and what's this problem and how the 5-minute solution that we're going to solve it today. But let's go way back to when this problem started. Let's look at all the factors that are bringing you to this place. And in functional medicine, we actually do a timeline where we look at a patient's like entire life, and they fill out all of this paperwork where we're looking at them as a whole person and what led to where they are. And I've sort of rounded that out a bit in the way that I look at weight, by looking at gut health and looking at genes and looking at hormones and looking at, all of these other factors, thyroid, adrenal health, and all of that. But it's basically this holistic way of looking at patients. So medical doctors, MDs that are trained like me in a very traditional medical school, went to a top 10, medical school, top 10 residency program, what people think of as like, the show ER or something like that. We can be trained in functional medicine, learn that holistic and more natural approach, and be trained in supplementation, but it's things that you do after medical school. You are not trained to do so in medical school. Naturopaths, their training really does focus more on the whole person. They're not as well trained in, say, acute care. Like most of them are not going to be ER docs or work in the ICU or take care of people who are acutely ill, but they do take care of a lot of people who have chronic medical issues. They do look at things from a more natural lens. That's what they're trained to do. You definitely want to go to a licensed naturopathic doctor if you're going there who's gone to one of the accredited medical schools like Bastyr or National or one of those that are the accredited ones, and in a state where naturopaths are actually licensed, but they will pretty much practice very similar to a functional medicine MD. Their outpatient practices are going to probably be pretty similar. The only thing is the MD sometimes has like maybe better insurance coverage or that kind of thing.
Got it.
Yeah. And then even like chiropractors or nutritionists can be trained to think in a functional medicine way. So that's just kind of a way of thinking about patients that comes after the regular training that you do.
But I do love the fact that you are an MD, you've had that traditional training, and now you're adding on, you look at the whole person. So I think it's just an added benefit to have all of that
Absolutely,
in what you do. Okay. So talk to me about the word I seem to not be able to pronounce. Nutrigenomics. What does that mean? Why do we need to know what this is? And talk to us about how this is playing a role in our health, our bodies, what we look like, what we feel like, all of it.
Well, I think it's really a key, and it's going to be really the future of medicine for everyone. Because for me as a doctor, it's really made so many things just pop into place when I look at a patient, be like, oh, why do they have all of these things going on? Well, a lot of times when you go back to their genetics, it can really make things very clear for you why they're facing a lot of things and why certain pieces of the puzzle for them are not fitting. And nutrigenomics is basically not testing genes for like the propensity towards cancers or things like that so much, although you can get some of that information also, but you're testing more for basically figuring out, based on this person's genes, what's the best lifestyle for them? What diet will they benefit from? For instance, will they or will they not benefit from intermittent fasting? There's certain genes that make it much more likely that you'll benefit from intermittent fasting, and other genes that make it much less likely that you'd probably do better eating more times a day with certain genes.
Like, give me an example of a type of gene that would play a role in.
Definitely. So there's a couple of genes that make intermittent fasting kind of tricky. One gene, which actually has a lot to do with a lot of other things too. It's a gene that I really like to talk about early, like for instance, when I teach other physicians about this idea of nutrigenomics, is called COMT. And this gene actually looks at breaking down fight or flight hormones like epinephrine, norepinephrine, cortisol, which a lot of people have heard of, which, can pack on the pounds when it's high all the time. It also breaks down estrogen. So there are people that have a normal variant of this enzyme where they handle all of these things, the norepinephrine, cortisol, dopamine, which is another thing that your body makes for concentration. They can break those down fine. They can break down estrogen. But there's people who have what's called a slow variant of this gene, where the gene just doesn't work that well. It's an enzyme and it just doesn't break these things down very well. So they end up with really high cortisol. For instance, if you spike their cortisol levels, if they get under stress, getting rid of that is not going to be a simple thing for them as it is for the normal person that has the normal variant of this gene. So if that person intermittently fasts and they spike their cortisol, well, now they kind of have a little bit of a big problem if you haven't really looked at their adrenal health before and made sure that they're not going to spike up their cortisol under stress. And, cortisol is a fight or flight hormone that you spike up under stress that can raise your blood sugar and keep you, much more resistant to the good effects of, low insulin, shredding fat, and all of those things. And so that person, you have to be careful if you're going to intermittent fast. There's another gene called PPAR gamma. That gene, if you have the variant of it and you fast, then you're going to actually become what we call more insulin resistant or less sensitive to insulin. And so you're going to make more insulin for any given blood sugar. And the problem is every time you make more insulin, you pack on the pounds. So you don't want to become more insulin resistant. But if you have the PPAR gamma variant, 1 in 500 people have that, and you intermittently fast, unlike the 498 people who are going to do great with intermittent fasting, you're actually going to become more insulin resistant and pack on the pounds. So those people are the ones that actually do well eating more frequently. And I've seen those people where it's now they're eating more frequently and they're actually doing better.
Wow.
So it's this very specific information. So that's what nutrigenomics is finding out the specific information about you based on the blueprint that you were born with, that you inherited from your parents. And of course, you get one set from your mom and one set from your dad. So you're not going to be all your mom or all your dad. Some of the genes, having one bad copy of the gene is going to be bad enough to derail you if you don't do certain things. Some of them you're going to have 2 bad copies, because as long as you have one good copy, for instance, you have an enzyme that works okay, like MTHFR is the gene that a lot of people have heard of. So that's what nutrigenomics is. It's looking at this from a nutrition, exercise, and lifestyle supplementation lens, and knowing that there's another concept there, which is really important when you're talking about nutrigenomics. And that concept is called epigenetics. And epigenetics means that the genes you're born with are not your destiny. They are a blueprint, but that epigenetics has to do with which genes you express. So you could be born with a certain gene, but you could have turned off the bad copy of that gene and be expressing the good copy that you have based on those epigenetic things that you're doing. For instance, maybe doing exercise that builds strength. Maybe you're doing HIIT training, which is indicated for that particular gene. And there's certain genes where HIIT training is really, really beneficial. There's a certain gene called FTO where HIIT training can make all the difference between someone being morbidly obese and not, for instance. But there's genes in which, like COMT, where HIIT training isn't really all that helpful because it can spike cortisol. So
what's so interesting about that, as I'm hearing you say this, is that I hear some doctors talking about portions of this, but not this whole picture. Like for instance, we've heard before, if you have your adrenals are shot, you should not do HIIT training. But this explanation is now making more sense to me. Yes, yeah. I had not heard that explanation.
Yeah. So this is
the after part
all the way back, to your genes and what they're doing. Yeah.
Which makes so much more sense than just hearing, oh, somebody told me I have my adrenal fatigue, I shouldn't do HIIT. No, there's so much more to that picture.
Yeah. Why do you have adrenal fatigue? Why do you have estrogen dominance? For instance, there's so many women who have, fibroids and polycystic ovaries and endometriosis combined with weight, because they're all estrogen dominant conditions that also lead to weight. Well, there's different reasons people are estrogen dominant. It could be this gene in the liver called CYP-CA1 that's your problem, or it could be that COMT, the gene we just talked about, is your problem, where depending on which of those is your problem, different supplements are actually going to work better or worse for you. So if your problem is in the liver, you actually want to use a calcium D-glutarate as your first supplement to try to reduce estrogen. People automatically think of supplements like DIM, but you actually would want to use that second in that case. Okay. Curcumin would work really in either case to reduce bad estrogens. Of course, you want to avoid them in the environment. And I have a whole thing on my Instagram all about environmental estrogens. But,
and I've also learned, and maybe this is incorrect, but I've learned that there's different paths for hormones. So for instance, this happened to me actually. Yes. I was taking testosterone, a small amount of that topical, and it was converting to estradiol in me, which made me have those estrogen dominant symptoms, which the whole reason was that.
Yeah. So you can have this enzyme aromatase that takes testosterone into estrogens, and some people have a stronger version of that enzyme. Some of us also don't have the detox pathways to deal with that. So for instance, if you have MTHFR or you have MTRR, which is the other variant of it, very common in those of us of Jewish ancestry, MTRR going along with MTHFR. MTRR has to do with the way your body metabolizes not folate like an MTHFR, but B12, and it can make you insulin resistant, estrogen dominant, give you fatty liver, but it's something that a lot of people don't put together. They're just looking at all these separate parts of the picture and not this united thing of, oh, it's this gene causing all these issues and need to go back to treating this gene, like taking the right kind of B vitamin to kind of fix all these pathways. So you're correct. I mean, things go down all these different pathways, and what works great for one person, a little bit of testosterone, may work really horribly for another person.
And this is just more the case. I always recommend that people work with a doctor like you, because you go to a regular, no offense against regular OBGYN, but most people, they just go to their OBGYN, especially women. And then your doctor will test and say, oh, you're low on testosterone because of this general range. And then giving a one size fits all, but not looking at all of these things.
Right.
Create additional problems.
Exactly true. Yeah. So, I mean, if you're in the right person, what could be a panacea is going to be a disaster.
Yeah. So. And that's why when you think you're taking one thing for something, it's actually going to something else. This is so important. So this is fascinating. So why aren't more doctors looking at this, and how can anyone request this type of testing?
So it's kind of a science that's in its infancy and emerging. There's more and more we know every day. A lot of docs don't go beyond what's in medical school. And a lot of docs really have this like, oh, they want big randomized controlled trials before they're going to incorporate something in their practice. Well, a lot of times you're not going to get randomized controlled trials for things that require natural medicines or lifestyle changes. It's just not going to happen. But we have some pretty good evidence on some of these genes now. So it's just a matter of wanting to be educated on it. And I think most docs are busy seeing a patient every 5 to 7 minutes, and they're kind of, stopping up the holes in the wall, and they don't really have time to look at this whole big picture. But a lot of docs are really interested. I run a room on Nutrigenomics every Sunday on Clubhouse, and I have mostly physicians in there actually trying to learn this, because it is coming home to them, and they're seeing that their patients are individuals, and they're trying their best to kind of come up with a way of treating them. Now, unfortunately, a lot of this testing isn't covered by insurance very well, but it's a once in a lifetime thing. Your genes don't really change. So once you know it, it's something and it's knowledge that can arm and help you for really the rest of your life. For me, knowing that I had the MTRR mutation made so many things make sense. Like, why did I have fatty liver? Why was I insulin resistant? Why was I estrogen dominant? And just fixing it with like taking one kind of B vitamin, it corrected so many pathways for me that were hindering me from losing weight. And when you can do that for someone, when you can say, there it is, that's your problem, or this is your amalgam of problems. But as far as how to do it, you want to find a doctor that does a lot of this kind of testing and really knows how to put it into clinical practice, because you can get kind of confusing things. Like, for instance, if you have the FGO gene, you benefit from intermittent fasting, but if you have PPAR gamma with it, then of course that's one of the ones that's a caution with intermittent fasting. So what should you do? A doctor that knows you and knows what your hormones look like and what's your cortisol look like and your adrenal health, that doctor can really guide you a lot better than like sending for a consumer genetic test and trying to self-engineer what all these different genes mean. So it's really important to find a doctor that really understands nutrigenomics, does a lot of the testing, and also does it in conjunction with like hormone testing, thyroid testing, adrenal testing, what we call cardiometabolic testing, look at your insulin levels and all that, so that they can put all this genetic information in the context of you. What's it doing for you?
I have a question about the hormone testing. Now, there's different ways to do hormone testing. Some people just do blood, some people do saliva, some people do urine. Do you recommend people do all three, just one? Does it matter?
It really depends on the situation that I'm looking at. Some people are kind of plain and simple with a little blood test. You can figure out what's going on. But if somebody seems to have, for instance, estrogen dominance, then I really like to do more detailed testing that involves looking at hormone metabolites. That's the Dutch test, which is a urine test, which looks at the metabolites of hormones. And that's really for people where I'm suspecting these hormones are really causing a problem, that the metabolites are causing a problem. And the only way to prove that is to really look at the metabolites of these hormones in the urine. Saliva testing is really helpful if you're trying to look at hormones in time. That's really the use of saliva testing. So if for instance, someone has really irregular cycles and you can't really pin down like what day of the month you're even going to check their hormones, then you can do a 30-day saliva test where they actually check every single day and you kind of get a variant of what all their hormones look like over the month, for instance. Or things like cortisol, where you really want to know what the 24-hour variation of that hormone is. Saliva test is amazing for that. So when you think of saliva, think of hormones and time. You're trying to correlate hormones and time. When you think of urine, think of hormones and metabolism. You're trying to think of what's happening in these hormones, as they're being metabolized, and either your body's not getting rid of them or getting certain metabolites that are harder to get rid of and all that. Blood is just the snapshot of that particular time.
Yeah. I know for using me as an example, for me, it was showing that my things are pretty normal, or I was a little bit lower on testosterone in blood. But when I started looking at the other stuff is where we found out it was converting to estradiol and that it was getting stuck like that.
Exactly right. Yeah.
So. Interesting. Okay. So this is fascinating. So Nutrigenomics, I'm going to say it right by the end of this podcast. You're really the first doctor I've spoken with that has really dove into this. And so I think this needs to be talked about a lot more. And
absolutely.
And I think it sounds like this really plays a role, not just with fat loss, just with any health issue in general that you're experiencing.
Yeah, absolutely. I mean, it can be life-saving. And that's actually how I got started with this. My dad had a heart attack. At the time he was 67, he's an engineer, a very precise person. And he had normal blood pressure. He was not overweight. He was not a diabetic. His cholesterol was picture perfect the day he went into the hospital with his heart attack. So he asked his cardiologist, like, why did I have this heart attack? And the cardiologist said, well, because you're old. And he just, as an engineer, did not accept that answer because he looks young, and now in his 80s, he's still working. And, he was like, no, I want to know why. And so that's when Nutrigenomics was coming out. I did one of the first tests on him. It was called GeneSNP at the time. And lo and behold, he had this MTRR mutation, which I have, which is the one that makes you insulin resistant and really builds up this toxic product in your vessels called homocysteine, which can cause heart attacks and strokes. And it's very common in his ethnic group. Middle Eastern Jewish people have a lot of MTRR. And then
it's making sense now why I have similar profile to you, because that's my background.
Your background, yeah. And then he also had a really high, what we call HSCRP, which is like the inflammation of his vessels, but that wasn't genetic. That was all the pizza and brisket and Grandies my dad was eating in the South. But there's definitely an explanation for his heart attack, which wasn't the usual. But his genetics had played the biggest role, really. And, I've had him on the right kind of B vitamins and anti-inflammatory supplements and diet, and he hasn't had another heart attack. He's 80 now and he's still working.
That's fascinating. Oh my gosh, I could talk to you all day. I have so many more questions with this, but I want to switch a little bit to just the idea of gut health, because gut health seems to be the trendy topic. Everyone thinks that that's response. Can we talk about that? Like, why is gut health so important? What does it mean? People just think it's my stomach, or what does it mean? Why is it important? Why do people need to know and understand this?
So the main reason that gut health is really important is the gut is really where your body meets the outside world. And so whatever you can't filter or keep, in your gut is going to leak out into your blood and become, part of your system. And also because the gut holds a lot of things, a lot of microbes and a lot of, this other sort of whole ecosystem in your body that is really active. It sends signals, it, digests your food. It actually makes toxins because they are bacteria like E. coli in there that are supposed to be held in the gut. So if your gut is what we call leaky or permeable, you're going to have a whole host of problems, starting with leaking the stuff that this bacteria is making. Like there's one called LPS, which is what gram-negative bacteria make, which is what they make in great amounts. For instance, when you have blood poisoning, well, if you have a leaky gut, you're going to be leaking small amounts of this and causing inflammation in your body all the time. And of course, inflammation really feeds fat. Fat is an organ that makes a lot of inflammatory modules to feed itself. And when there's more inflammation, there's more fat. So that's one reason gut health is really important. The other is that gut health affects all the rest of your health. If your gut is not really if you don't have a good barrier and you're not keeping things in, you're going to start, leaking big molecules across your gut, and you're going to start reacting to those things and getting things like joint pain and, autoimmune issues and all kinds of really, havoc going on. So, one of the naturopathic sayings, which I really love, which is kind of one reason I've really bent so much towards naturopathic medicine, is the road to good health is paved with good intestines. And and it really is that, because that's your first barrier. That's where your, entire ecosystem that could be helping you or harming you, all of your microbiome is. And, it's your first barrier to things that can get into your blood and start causing havoc. So it's got to be a good barrier.
So what are some of the main things that just general knowledge for people that they need to know about gut health, like things they should be doing? For example, like, should everybody be eating fermented food? Are there certain foods that they need to be staying away from that affect our gut health? So if you could help with some general things about general gut health 101.
Absolutely. So here's some general things for everybody. I mean, there's hardly anything that I tell everybody, because all of my recommendations are also personalized, like based on genetics and hormones and all that. But there's some basic principles. One is you want to eat as organically as you can, because, basically herbicides and pesticides, glyphosates, all of these things are really damaging to the gut. These extra antibiotics that they give, for instance, non-organic animals, can be really damaging to the gut. So you want to eat as organically as you possibly can. And you probably want to eat, anything that's an animal needs to be grass-fed and organic, really, because a lot of these animals who are in our agricultural system are never meant to be grain-fed, and so they're actually diseased animals when they're grain-fed. So that's why grass-fed organic, if you're going to do anything animal, is super important. For most people, dairy is actually pretty inflammatory. Not 100% of people, but I'd say 98% of people should probably stay away from dairy, unless you come from a goat and sheep herding tradition and you're able to get like organic goat and sheep milk. You should.
What
probably
about
stay away
raw
from
milk?
dairy.
I've been told, and maybe I'm wrong, but that if you do raw milk, because you still have the enzyme intact, so it does help break it down. Is there anything to that, or is that not true?
It's probably true to some extent, but then of course you have some microbial issues that can happen with raw milk. And so you have to be really careful of how and where you're getting raw milk and all of that, because you can get brucellosis and all that. So you have to make sure that it comes from a farmer who really knows what they are doing. And again, still, I'm not sure that cow dairy would ever be something that I really recommend to people. It would still be sheep and goat, because that's traditionally what people ate, which is closer to human milk.
Okay.
Even if you're going to do raw, and you'd want to know that you're dealing with someone who really understands like sterile technique and how they're collecting their milk, and
because you could basically get other problems trying to avoid one.
You can
problem.
get other problems. So you got to be kind of careful with that. So those are some general things. The other thing that I would say is really important, generally for everybody, is to avoid refined oils, things like canola oil or vegetable oil or soybean oil, which are most of the cooking oils that we use in America. Those are packed full of really terrible kinds of fats called omega-6s, and not good omega-6s, which can really increase inflammation. So that's another big tip is, try to do your fats more like avocado oil, coconut oil, the olive oil. Olive oil, as raw as you can. It has a pretty low smoke point. But, cook with things like avocado oil, things that are not refined oils. Is a really big tip for everybody's gut health. As far as fermented foods, some people can tolerate normally fermented foods and others can't, but nearly everyone can tolerate an old world kind of fermenting called anaerobic fermenting. You actually have to do it in special jars that off gas and kind of learn how to do it. But most people can tolerate these anaerobic pickles because they don't have a lot of yeast, which some people can't tolerate. And they have a lot of Peptostreptococcus, which is a kind of bacteria that's really good for the gut and for the mouth. And so if you're going to do pickles, I really recommend doing anaerobic fermentation if you're doing it for your gut health.
And do you have to do that yourself, or can you actually buy things that are labeled?
There are a few things that can be bought, but usually you kind of have to learn to do it.
Wow.
Which
okay.
is kind of
so your kosher dill pickles from the grocery store are not the ideal fermented food for that.
Probably. I mean, some of us can tolerate those fine and they're helpful to us, but some people can't.
Yeah.
If you're going to do a probiotic, don't do the monoculture over-the-counter probiotics that are 1 or 2 probiotics. That's really doing your gut a good disservice. If you're going to do a probiotic, you want one that's actually dairy-free, corn-free, and has a lot of different microbes in it, including the Bacillus series, which are soil probiotics, including Bifidobacterium, which is a really well-studied probiotic. So a lot of people do probiotics for gut health, but they do like the wrong probiotic, and they're actually almost making like a GMO culture in their gut of 2 kinds of probiotics or something. So you don't want to do that.
Good
You want
to
to do
know.
something very, well.
Is that one of the
balanced.
supplements that you have?
I do have a really good, diverse probiotic that people can get.
Okay.
On the Dr. Emi line. So it is something that I like to guide people to if they are going to do a probiotic, which not everyone, if they're eating perfectly healthy and doing a lot of anaerobic fermentation needs, but if you're not able to do that, it's a good thing to have.
Are probiotics kind of like insurance the way vitamins would be? So like if you take a multivitamin, okay, so it doesn't hurt to add it if you have the right one, I'm assuming?
For most anybody, it doesn't, except if you have active Crohn's disease that's not well treated. That's the person that really needs to talk to a doctor before taking a probiotic. But most anybody.
And why is that? Does that exacerbate it, or what happens?
Well, they're afraid that it might leak across their gut into their blood if they don't have, if their Crohn's disease is really active, or that it can sometimes, make it worse for some people, according to some docs with that. And that's if you have active, untreated Crohn's that's acting up and you have, entry into your blood from your gut at that point.
So one thing Dr. Emi does that's absolutely fascinating, and I highly suggest this if you're fascinated by all of this and you're like, I need to have this testing and I don't have a doctor that does this. She has a concierge practice where she takes a handful of patients a year that are her basically private clients, that you have just phenomenal access to her for all of this testing and for one-on-one coaching, really, but from all of her knowledge, so she can help customize things for you. So I highly suggest that. How do people find out more about applying to work with you that way? And then how can they find your supplement line?
So my supplement line is actually linked in my Instagram profile, if anybody follows me on Instagram, which is dr.spelledout.emi. But you can also do store.drspelledout.emi.com. So store.dremi.com.
I'll put this all in the show notes too.
Yeah, so that's kind of where you can find my supplements. As far as the program, the best thing to do is to actually just either message me on Instagram, or if you're not an Instagram person, you can email me at dremi@myvibrantwellness.com, and I will send you a questionnaire to see, if you are one of those people that could maybe work with me for the year. So
this was so helpful today. I'm sure we're gonna have to have you on again because I'm gonna have a part 2 of questions, but thank you so much for sharing all of this today. This was super helpful.
It was really fun to be here.
Thank you for taking the time out of your day to listen in as my guest today. If you found this episode valuable, please share it with friends and on social media. I don't advertise this show, so I rely on word of mouth and reviews to get it out in the world. The biggest thank you that you can give me is leaving me a review, and a nice one, I hope, by the way. This is how others find these episodes. If you do leave me a review, be sure to message me at support@nataliejillfitness.com with a screenshot of your review, because I would love to send you a free digital download of my DSR journal as a thank you. And please don't forget to connect with me on social media at Natalie Jill Fit on Instagram and Facebook.